I'd like to focus on the trauma and the critical role that the rehabilitation services play in trauma patients. Trauma patients often come in with significant comorbidities, and they acquire significant complex injuries that are not solved instantly in the hospital setting. And what I've appreciated about this physical therapy and rehab unit, as opposed to many others that I've worked in, is that what can be simply described as, perhaps tritely, as a holistic approach. Patients need both emotional, physiological recovery plans, and these plans need to incorporate their families as well. What can the family provide? What can we do to get the patient back into their environment? What can we do to provide total, not just physical, but psychological recovery from the events that they're involved with? Many of these patients come with issues that seem simplistic, but are in fact not. Chronic pain issues, developed pain issues, post-trauma stress disorder. And they and their families need to work together to get a complete recovery. We tend to be focused in the in-hospital side on, we took the spleen out, we fixed the leg, but we're not that skilled on how do we get this youngster back to school in a functioning fashion? How does the family deal with the emotional stress of seeing their father going through a prolonged period on the ventilator? And all these are critically important, not only to the hospital in terms of getting patients out and back into society, but for the family and for society at large. And the rehab services here provide an extension so we can follow through on our promise to take care of the patients the best that we can.